Where is that bottle? Oh, I have something. No, I've seen that one already. That one's empty.
So, Ms. Drew? Hi, I'm Dr. Harding, and Nurse Ames told me that you might be having some alcohol withdrawal.
I'm sure he did.
So I'm here to do an assessment. Are you feeling nauseous at all?
Yeah, but I can't pick anything up. I
Okay.
feel so sick.
Okay. Can you hold your hands out for me like this and spread your fingers? Okay. And then can you show me, are you sweating at all?
Oh, I feel so hot.
Yeah. Can I see your palms? Okay, yeah, they feel pretty moist. Yeah.
It's so hot in here.
Do you
It's
feel
so hot.
anxious?
Yes, I feel anxious. Don't I look anxious, you silly cow?
You do look anxious. Okay.
Hurry up.
Okay. So are you feeling anything like pins and needles?
Oh, I'm itchy.
You're itching
Just
or
itchy.
burning?
It's like there's
numbness?
No, just
Okay.
itchy.
And how
Bugs,
about
maybe.
sound?
Sound.
Are
No, it's
sounds
just-
harsh?
Yes.
Okay.
Yes.
Are you hearing anything that isn't in the room right now?
What in the world does that mean?
Anything
You think I'm
that's
schizophrenic
disturbing?
or something?
No, it's just a standard part of the
No.
assessment. And how about the lights? Are the lights
are
too
really,
bright?
really bright. Can you
They're
turn
really
them
bright?
down?
Okay, can we turn down the lights? Thank you. Okay. And how about your head? Do you have a headache at all?
Yes, I have a headache.
And how would you rate it on a scale of 1 to 10?
I don't know. What's 10? I have no idea.
10 is the worst.
It's like a band. It really, really hurts.
Okay. Okay, and do you know where you are right now?
I'm in the hospital.
In what city?
San Francisco.
Yeah. And what's the date today?
I don't know. It's April.
April, do you know the
No.
year?
Yeah, 2012.
Okay. Okay. And Nurse Ames is going to come in and take your vital
please
signs right
hurry.
now. Yeah.
Hi, Ms. Drew. My name is Nurse Ames. I'm going to take your vitals real quick. If you can just hang on a second.
Hurry up. I hate having my blood pressure taken. Eat it. Oh, damn.
I know this is very uncomfortable.
Okay, we're going to slip this right under your tongue real quick. Careful and slow. Thank you.
Feel too bright.
Hey, Dr. Hardy, we got a BP of 150 over 90, pulse of 110, respirations of about 20 to 22, and a temperature of 37.5.
Okay, we should start the protocol.
I think that's it.
So we're going to go over the assessment and come back and give you some medications to help
Yes,
you.
please, please. Oh, God, you guys just take
Okay.
forever doing everything.
Okay.
Hurry up. Hello. You have just finished watching a reenactment of a patient in alcohol withdrawal, and now we're going to go over the Clinical Institute for Withdrawal Assessment scale. And the idea behind this is to look at different symptoms of withdrawal and assign a score, and then have a total score, and then base your treatment of the patient based on this score. So my name is Theo Jacobson. I'm the clinical nurse manager for the Department of Psychiatry. And we were also joined in the reenactment by registered nurse Chad Ortega, and he was Nurse Ames. And we were also joined by Jewel Adler. She's a psychiatrist, and she played the part of Dr. Harding. And I was Nancy Drew. So let's take a look at the first section of the CWA assessment. It is on nausea and vomiting. So take out your scale, and I want you to score as we go through each section. So the first section was nausea and vomiting. How you would start the assessment is you would ask the patient, have you been feeling sick to your stomach? Have you had any vomiting? So in the reenactment, I definitely talked about that I had nausea pretty much all the time, or a lot of the time, and I did have the dry heaves, but I was not vomiting during the assessment, and I didn't refer to any previous vomiting. So please complete your assessment of Nancy Drew. What score would you pick for her? Okay, so I would assess her as a 5 out of 7. She did not have vomiting, but the other symptoms were pretty significant. The next section on the scale is sweating. Sorry, is tremors. The next section on the scale is tremors. And you would ask the patient to put out their hands and you observe to see if there's any shaking. So I had a tremor. Sometimes you can't see the tremor and you actually have to hold on to the hand. So take a minute and complete your assessment on Nancy Drew. And what score would you give her? Okay, I would give her a score of 5 because there was a visible tremor. Now do be aware that some patients can fake a tremor. You can also ask them to stick out their tongue and observe their tongue. That's harder to fake. And the other thing you can do is ask them to watch your finger and move it side to side. If they have tremors, their eyeballs will vibrate. The next section is sweating. You may have been able to see that my palms were very moist and I actually had beads of sweat on my face. So take a minute and finish your assessment of Nancy Drew. What score would you give her? Okay, I would give her 5 because of the beads of sweat, but I was not drenched. You can see some patients, their whole clothing has to be changed fairly frequently. The next section is anxiety, and you can ask the patient, do you feel nervous? Are you worried about things? So I said that I was anxious. Sometimes a patient will say that they're anxious, but they don't look anxious. You still give them a score for saying that they're anxious because lower levels of anxiety are felt internally. So take a minute and assess Nancy Drew. What score would you give her? I rated her as a 6. She was pretty anxious. She could hardly sit still, and she certainly talked about anxiety throughout the interview. And now we'll move on to the next section, and that is agitation. I showed signs of agitation when I was criticizing the staff or asking them to hurry up through my tone of voice. There is a difference between anxiety and agitation. Anxiety is more worried, sense of doom, anxiety, butterflies in the stomach. Agitation is more outward and it's more aggressive and it's more related to anger. So they are two different things, and patients can have both or one or the other or neither. So I was definitely agitated. Take a moment and rate Nancy Drew. Tell me what score you would give her. I gave her a 6. She was agitated most of the time and over little things, and her anger flared up fairly quickly. The next section we're moving to is tactile disturbance. You would ask the patient, do you have any pins and needles? Do you have any burning? Do you have any itching? Throughout the interview with Dr. Harding, I was scratching a lot. You would have noticed that. And I didn't have any burning or itching. So take a moment and complete your assessment of Nancy Drew and tell me what score you'd give her. Okay, I gave her a score of a 3 because she wasn't having full-blown tactile hallucinations. Some patients do have full-blown tactile hallucinations, and they feel like there are ants crawling underneath their skin, and in fact they might even be trying to rip off some of their skin, or they'll have intense burning or intense pins and needles. Our next section is auditory disturbance. You would ask the patient, are the sounds harsh? Are you hearing anything that's disturbing to you? I definitely was sort of wincing when people were talking, and I asked them to lower their voice. So you take a minute and you complete your assessment and let me know what score you would give Nancy. Okay. I gave her a score of 3 because the sounds were harsh, but I didn't have a full-blown auditory hallucination where people were yelling at me or there were voices that I was hearing. The next section we're going to go on to is visual disturbance. You would ask the patient, does the light appear to be too bright? Are you seeing anything that is disturbing you? So again, I was wincing with the bright lights, and I asked them to turn down the lights. They were still a little bit too bright, but they were okay. Take a minute and complete your assessment. What score would you give this patient? Okay. I would give her a score of 3, moderate. I wasn't having any visual hallucinations. People who are in the full DTs, they will have a number of different kinds of hallucinations, and visual hallucinations, they can see bugs on the wall or little soldiers talking to them. So for me, I was just wincing with the bright light and finding it too bright. The next section would be headache. You would ask, do you have a headache? How would you rate your headache on a pain scale? Be careful not to rate for dizziness. So I did refer to having a headache. I believe either Dr. Harding or Nurse Ames asked me how I would rate it, and I said 7. So take a look at your scale and complete your assessment of the patient and tell me what score you would give for a pain scale of 7. Okay, I rated a 5. I did describe having a pain scale of 7, and I also had a band-like sort of a tension headache. So that would be a score of 5. The next section is orientation. Was I oriented or was I not oriented throughout the interview? Take a minute and finish your assessment and select the score. Okay. I think I was oriented, so I got a score of 0. One thing we didn't do was ask Nancy Drew to do serial additions. You start with an easy number like 3, and you start the patient, you go, what's 1 plus 3? It's 4. Okay, what's 4 plus 3? And then you let them go. Sometimes people have early signs of disorientation. They might know where they are and who they are. They might know the day of the week, but they can't do the serial additions. So ask that as well, in addition to the usual orientation questions. And if they can't do the serial additions, then they would score a 1. Okay, so add up all your points and tell me what you have. I have 41. Some of the scale's a little bit subjective, so if you're off 2 or 3 points, I wouldn't worry about it too much. If you're off 4 points or more, go back over the material and figure out where you scored a little higher or a little lower and see if you can refine this. The other thing that you would do is check the patient's vital signs. This is very important. Some patients have changes in vital signs before they actually have the withdrawal symptoms that you can observe. Some don't. Nurse Ames took my blood pressure and my pulse, and I had a high blood pressure and a high pulse, and this was related to my withdrawal. So you'd want to include that in your assessment. Now, parts of what you also need to know, along with the CWA, would be a sedation scale, because you'll be giving medications that cause sedation, and you don't want to over-sedate the patient. You want to give them adequate treatment for the symptoms of withdrawal, but not